Welcome. Good morning. How are you? Welcome to one another hip mobility video. This is an important video regarding the hip and the hip mobility. So we gently sit in our hips and gently move our legs. Our hip flexibility and mobility helps us to regain our mobility, the mobility that we lost because of non-usage. So we are going to begin with gently bending our legs, preparing ourselves and dropping the big toe to the inside like a Charlie Chaplin leg and outside. So when you are going to bring the legs in, what we are doing is internal rotation of our hips. You see Cookie, say hello to Cookita. And when you are dropping the big toe to the outside, what you are doing is the external rotation. So internal rotation and external rotation of our hip joints, hip sockets and all the associated muscles and tendons. So with mobility, we try to regain the mobility that we have lost because of non-usage. For example, internal external rotation, we don't do that much often, so we lose that mobility. So we are gaining, we are doing it for 7 to 10 times. If you feel too discomfort, you can bend your legs a bit closer, your heels can be more closer so that you can work on your flexibility and it opens your hips, glutes and the organs associated along with that. Yeah. So remember, you always try to apply Mula Bandha and then you are trying to keep Uddiyana Bandha so that you can keep straight, and then we are greasing our hips joints by doing this Charlie Chaplin leg. Yeah. Hope this is in line with what is our expectation. So we are going to continue with doing the same, maybe a few more times. The second exercise that we are going to do, you can always stop the video if you need more of the previous exercise. You can always stop, you see how it is there. For example, if you are a beginner, you might have to do the Charlie Chaplin leg twice, thrice, like 20 times, 30 times before we move on to the next asana. Yeah, so be mindful. For example, the way I'm sitting, it's kind of gently kind of opening your hips. So this is like an in pose, so you are going to keep holding the in pose for as much as possible. In that way you are opening your hips and hip sockets. So now bring the hands back to your back and we are going to gently rotate your ankle to include our other mobility action, inversion, eversion, to work on stretching and strengthening our leg muscles, pointing the toes, flexing the toes, point, flex. Beautiful. We are going to lift the right leg and we are going to adduct. We are going to bring it inside and we are going to abduct, bringing the leg outside. Adduction, bringing the leg toward the center of your body, and adduction up. You are using the hands as a weight. If you need to bend your legs, bend your legs. So this is one mobility movement that we don't do. Lateral movement of our legs, adduction and abduction. So we are trying to include that, and here we are going to externally rotate our legs at a lifted position. We call this extended position, and back straight, head straight. If you have to go onto your sacrum, go onto your sacrum. This could be bit strong on your hip joint. Beautiful. Once you have done, we are going to bend that leg, half butterfly. You know, butterfly is a very beautiful pose to work on our hips. So since both legs gets wear and tear in a different way, half butterfly helps us to regain. In a full Bandha Konasana, we butterfly, and maybe sometimes we have to we are not we have to pushing ourselves one side, and after we finish, you know, as you see, I'm going to bend my legs and stretch my legs. In that way, I'm enjoying the stretches of my leg. Beautiful. All through the practice, remember to breathe as long and deep as possible, relaxing the leg on this side and preparing for the other side. Beautiful. Leg up, adduction, abduction, adduction. Use your core, Mula Bandha, and feel the strengthening of your leg. You can always bend your leg and you can do 3, 5, 10, 12, whichever works for you. Just because I'm doing, you don't have to do it, but it is always good to push yourself to limits. And now we are going to internal rotation and external rotation of your legs. Breathe. Remember to breathe. You see, that's how, as I'm showing, our femur bone is inside of our pelvic girdle, and we are going to go for the leg stretches to open off one side leg. I'm not only bending, I'm also pressing my knee towards the mat, opening my hip joint and hip socket. And I'm going to go for the half butterfly on this side to adjust and balance any mobility that is lost. Beautiful. Now we are going to do something called 90-90-90 stretch. This may be a bit strong for you, so you can have a look how it is going to work. So my front leg is parallel to my front shin. My shin is parallel to my front short edge of the mat, and the back leg is parallel to the long edge of the mat, and my hips facing forward. If you have this possibility and flexibility, if it is not there, you can use your hands on the mat or give a block under your right glutes. You see, falling forward, I can feel a very nice stretch on my lumbar back. This is exactly what we do when we are doing a pigeon pose. While coming up, you see I'm using my hand. I'm not using my hand and coming up, using the strength of my lower back and my hips. So second time, I'm going down without using my hand and exhale, coming up. It should be an inhalation to come up actually. So exhale, falling forward whenever you are opening the body. If by any chance you cannot keep your hips forward, you keep the hand down and try to work on your hips rather than trying to achieve something. So we are going to change twist. Now my navel is in line with my bent other leg. I'm switching and I'm going to go forward and back. Maybe sometimes you don't find any stretch at all because maybe your knee, you are more flexible, or you are not gone to a place where it is comfortable. As you can see, I switched off the legs. Now I'm lifting the back knee off the mat, externally rotating my hips. Visualize how I'm externally rotating the hips. Again, usage of hand is possible. Now I'm internally rotating my legs by lifting my back leg. You will find cramps in your hip socket because maybe you are using it after a very long time, internally rotating your hips. So if it happens, cool down and go back again one more time. Beautiful. So we are going to do 10 times, 7 times, 5 times. You see, I'm trying to lift my back foot up and putting my knee down. Now I'm lifting my knee up, completely opening, externally rotating, and dropping the knee, internally rotating, opening my hips completely and dropping my knee completely. Beautiful. Internal and external rotation of your hips, hip socket, hip joint. Breathe. Again, I'm doing it for 10 times, but you decide how much you can go. We are going to go for the other side. This time my left leg is in front, my left shin parallel to the front edge, back leg parallel to the back edge, and I'm coming down without using the help of your hands. If you have to use your hands, please go ahead. You see, I come down and then I come up with my hand without my hands. Try to keep your hips squared, facing forward. One hip may be difficult, so you might have to use your hand. Enjoy the sensations at your hip level. You're basically doing a pigeon stretch. Now I'm going to externally rotate my hips by lifting my knee. My foot stays on the mat. My back shin is parallel to the long edge of the mat. Beautiful. Internal and external rotation of your hips, hip joints, hip socket. It's a beautiful mobility workout. If you have lost your mobility because of, sometimes it happens because of accidents, because of childbirth, because of XYZ reason, you have to do it very slowly. So we are going to do not more than 5-7 if you feel any cramps. And now we are going to internally rotate your hip joint by lifting your foot off the mat. Your knee stays on the mat. You can see there is very less mobility for me, and I'm using my hands on the mat, but still I have very less mobility. So you decide what is good for you. And once you have done, externally rotating your leg by lifting your knee, and while dropping down, you see the foot stays parallel, and I'm going from the external edge to the internal edge. While going out, my foot goes to the outside edge, while dropping, internal edge. Beautiful. 3 to 5 times. Very good job, everyone. Now we are going to bend both legs like 40 centimeters between your leg and dropping both knees. As you can see, I'm externally rotating my leg. I'm trying to push my both knee towards the mat, and I'm doing the opposite side. My knee is trying to touch my foot. Externally rotating. You see, I'm losing all my upper body weight on my arms, and I'm only working on my hip joint. Nothing more, nothing less. As you can see, my foot goes from outside edge to the inside edge. My knee drops. There is no rotation at the knee level. All the action happens at the hip level. I'm not rotating my knee, as rotating your knee will give you pain, and it can be very bit of dangerous because of the tendons, but not so much because the pressure is not so high. Yeah, now we are going to stretch our upper body. Now we have opened our hip mobility, and we are going to enter that space by bringing your upper body as much forward as possible, dropping your foot and giving yourself a very nice stretch. Breathe, breathe, breathe. Breathe, breathe, breathe. Gently walking your palms back. Bend your one of your legs, other legs. My left leg goes onto my inside crease of my right hand, and I'm doing cradling the child, opening my hip socket. A beautiful mobility workout. 5 to 7 times. Change of side. Back straight, head straight. You are sitting on your sitting bones, not on your not on your, as you can see, I'm not on my spine, crunching my spine. I'm not bending my spine. Back straight, head straight, cradling the child. It's a beautiful exercise for hip mobility. Beginners, you can only do this. Yeah, again I'm going to move my muscle around, and we are going to check how the immobility improved. So you might remember the Charlie Chaplin leg that we begged at the beginning of the practice. So we are going to do the same internal rotation, trying to drop your pinky toe. Be mindful about your knee. The rotation is not happening at your knee. The rotation is happen at your hip joint. Beautiful. I see a difference in my internal and external rotation. That means I have improved the mobility of my internal and external rotation. Beautiful. From here, we are going to go for some stability and stretch your hips before we conclude the session. Lift your upper body up, Malasana, toes pointing forward if you have this possibility, toes pointing out or on your heel. Anything works. The upper body comes. Push your knee away from your hips so that your hips and foot are in line. We are going to stay there 5 to 7 breaths. It's one of the most beautiful, awesome stretches. And we are going to check our mobility by shifting our weight to one leg and stretching the other leg, rotating the leg. If this is too difficult, don't try. You can try. As you can see, I'm using my hand, and I can also do it without using the hand if you feel you are strong enough. So both works fine for me. If it works for you, it works for me. Beautiful. And from here we are going to go for few more breath in Malasana. Keep working our hips, keep opening your hip. The more hip open, the more possibilities we have. From there, for the last stretch, drop your palms just in front of your foot. Stretch your arms, stretch your legs so that you can really keep stretching your hamstrings, and keep stretching and stretching and stretching. Beautiful. This is the final stretching. You can always stay here. Your hip mobility. This is a 15 to 16 minutes of hip mobility workout for beginner level. You begin this, you keep practicing this, and we see you next time soon. Have a very good day. Thank you for watching. Please share and subscribe. Vanakkam.